So as the title suggests, it is in fact true that I contribute a majority of my knowledge to videos during my first 3 years of medical school. And maybe you can do the same. So I'll give you my top tips so you know whether or not this is for you. So for those who don't know, at least here in Denmark it takes 6 years at university to study medicine. The first 3 years you get a bachelor degree, and after you have completed the last 3 years you have a master's degree. But the bachelor part of med school is where you learn all the basic knowledge about how your body functions, your immune systems, and you don't learn anything about how the diseases work yet. Pathology, or the study of diseases, is reserved to the last 3 years of med school. So first we learn how the body works normally, and then we learn what happens when it's broken and how to fix it. So luckily a normal body is the same all around the world, and the whole world agrees on how a normal body functions. Which is in contrast to law school. You wouldn't want a Danish lawyer on your case if you live in the US. Whereas if you get sick in the US and you got a Danish doctor, that wouldn't be such a big problem. So the subject that you study really have to be universal if you want to watch videos online and skip lectures. So back to med school, where the first 3 years basically is going to lectures all day in a dark room, where some PhD is forced to teach you as part of his PhD program, even though he hates to teach. Some are good, but most are bad. At least that's how I felt in comparison to going online and finding some of the most brilliant teachers. Online you can find someone that totally caters to your needs, and you can shuffle around until you find someone that exactly fits what you're trying to learn and that makes it easily digestible for you. So to know if this is for you, I'm going over some of the considerations. Firstly, you must be able to structure your own time. So you need to have some discipline. If you don't show up for lectures and you don't study on your own, it's pretty much game over. Though, yes, technically I did cram some subjects in a few weeks, which gave me some more free time. But yeah, if discipline is lacking, I would suggest finding a study partner. I had a few people I would meet up with every day and we would study on our own, but then we would hold breaks together. This made it possible for us to ask each other questions whenever we encountered something we didn't quite understand. And I cannot count on 2 hands how many times it's come in handy to have other people to discuss with what comes up on the exam. Okay, so first point. Breaks. So this is what I love about studying on my own. Are you insanely hungry? Do you need to pee? Are your water bottle empty? Are your attention span depleted and you need 3 to 5 minutes to do some push-ups or a small jog? The teacher does not care about your bladder. Those caffeine overdosing, dehydrated, sandal and white sock wearing, reptile looking teachers have a bladder capacity way beyond you and me. But seriously, I would often find that they lecture for way too long. I need a break at least after 30 or 40 minutes. I just need a small break every now and then to make studying more effective, especially if, like me, if you have ADHD tendencies and struggle to sit still for extended periods of time. Next, you have to deal with your FOMO. A lot of my fellow students went to lectures because they were afraid that they would teach about something that wasn't in the book, or that the lecturer would go in detail about a topic that the lecturer would find interesting and therefore be sure to come up on the exam, which they made the questions for. I kid you not, but a few students would attend a lecture and sit there in the back of the room and watch Vampire Diaries or play games on the computer as they were afraid of missing out. I believe it's more important to become good at your skill. But just because your professor added in a couple of questions about his niche topics and you can't answer them on the exam, which draws you a couple of points down and therefore a lower grade, I couldn't care less. I believe in becoming a great doctor and focus on the bigger picture. Of course you should be able to do great on the exams, just not on the 2 or 3 niche topics that he put in his own interest. Okay, another benefit of studying online on your own using lectures is that you'll be able to go back and rewind something you didn't quite get, or just press pause if you need some more time to jot down the notes. Another benefit is that you can practically study anywhere you want. So if you want to go to Bali and stay for a month, you could. At least at my uni. We didn't have to meet up for anything except the exams and pass those to get to the next semester. But how did I know what videos I should watch? So fortunately at my university, with each subject and its exam there was a PDF document stating what and in what detail a subtopic should be mastered. For an example, be able to describe the cell cyclus and its stages, and in detail the stages of the cell division. So straight onto YouTube, find Dr. Najib or Amanda Hasurugan, which I need to give a special thanks to, especially Dr. Najib, which I have watched countless of hours of videos from. I believe I bought it back when it was $50 for a membership, unlimited. It's $1 now, and it's ridiculously not, you'd be ridiculous not to buy it if you like video form. It's insane how many videos I've watched from Dr. Najib. On some topics I would watch a lot of videos online, especially neuroanatomy, where I have watched all Dr. Najib's videos. Sometimes a little more reading is needed, but in my own humble opinion, my results was diminishing from going to the lectures. So after a couple of months I stopped going to lectures, which is the best decision I have ever done. I felt like that if you go to a lecture, I would just sit there and all the lecture would just talk and talk, and I couldn't follow along and get the notes in the exact order, and it would go too fast and I didn't quite get something, and I feel like I had to rewind to really get what he was talking about. And some lectures would also be about anatomy, and if you have 15 seconds to get all the anatomy of the kidney and all the small arteries and vessels, there's no way yet that you can understand all that and memorize it in 15 seconds before he moves on to the next slide. And he would do that for like an hour and have 150 slideshows to go through, and in the end you would just sit there and you would have a grasp about what the topic was about, which can be fine, but you need to learn it. You need to really dig in, you need to get some repetition in. So I felt that I could do that on my own. I had the PDF document stating what I needed to learn, and I would just go online, find the videos, learn what I needed to learn, and I got really good grades on the exam. So hopefully, if you go to university and you sit there and you think that there's some better way to do this, you should try. You should definitely try just to study on your own, find some partners that are willing to study with you so that you can talk to each other about topics that you don't quite understand and what is important to know at the exam, because some people, especially in the beginning, will have a hard time figuring out exactly what the questions are about in the exam, and how to study, because some people would just study, but they would end up studying the wrong things sometimes. Alright, so remember to subscribe to be healthy. See you in the next video, and if you want to be notified about future videos, also hit the bell icon down here. At least I hope that you got something useful from this video. I will see you in the next video. Bye.